The masseter muscle is one of the muscles in charge of the mastication, and it can bulge, producing a non-smooth contour. However, it can be treated with botulinum toxin to reduce its bulging state. Due to its size, it is easy to see during the ultrasonographic scan. The masseter muscle is seen as a hypoechoic structure with some tendons, lying over the ramus of the mandible. The presence of the deep inferior tendon is important, because it is believed that it can restrict the diffusion of the toxin between the deep and superficial layers. The posterior border of the masseter muscle can be partially covered by the parotid gland. Also, you can record the movement of the muscle during the clenching with aim of the ultrasonographic imaging. Please bite. At the temple region, several procedures are performed, such as filler injection for correction of the hollow temple or the insertion point for threading lifting. However, there are some anatomical structures that we must consider before starting any of those procedures. The superficial temporal artery is located in the superficial temporal fascia, and it runs between the tragus and zygomatic arc to then branch off into the frontal branch and the parietal branch. Those branches could be located in the region where most of the above-mentioned procedures are performed, becoming vulnerable to damage by a needle. We can start taking the path of the superficial temporal artery using the color Doppler mode at the level of the eyebrow tail, near or inside the hairline. And then, to confirm, we will take the vessel with the aim of the pulse wave Doppler. Yes, that's the typical sound of an artery. So now we just confirm that this is a superficial temporal artery. So, in order to avoid blood vessel damage, it's important to take the path of the superficial temporal artery. The glabella can reveal some of the most common signs of facial aging, such as the glabellar lines, or also known as frown lines. So on, several procedures are performed in this region to enhance its appearance. However, one of the terminal branches of the ophthalmic artery, the supratrochlear artery, runs in this area. If we accidentally inject some product into this artery, severe consequences such as skin necrosis, cutaneous granuloma, or even blindness can arise. But don't worry, with the aim of SONO-Finder, you can avoid the vessel and get the best outcomes. We can take as reference the medial end of the eyebrow and around 1 finger width above the orbital rim to start the examination. Once we found the location of the vessel, we can move to the pulse wave Doppler mode to confirm whether it's an artery or vein. Yes, this is the sound of an artery, in this case the supratrochlear artery. The supratrochlear artery can be placed near or beneath the glabellar wrinkles, so you can ask your patient to frown and then examine the wrinkle area. For a safe and neat procedure, first check the location of the vessel and then decide the approach you will use for this region. With SONO-Finder, the best outcomes are on the palm of your hand.